my name is Robin and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 231.
Yep.
Do you have time to give me a report?
Sure. Shanae O'Connor, and she's 34 years old. She's a female. She's allergic to trimethoprim sulfamethoxyl, and it causes a rash. She's a full code. Her doctor is Dr. Engelbert. She weighs 177 pounds. She was diagnosed with a fever, and she has end-stage renal disease. She's a diabetic type 1. She was admitted to the emergency department with fever, chills. She had high blood glucose levels, decrease in appetite, decreased urine output. Her husband is present with her. She has a history of renal failure, diabetic neuropathy, hypertensive nephrosclerosis, hemodialysis. She gets 3 times a week this past year. She was listed as a transplant 6 months ago. She's alert and oriented times 3. She looks uncomfortable. She moves all extremities. Her cranial nerves 2 through 12 are intact. Sensation is diminished in her lower legs. ProLab, she speaks English. Mild weakness. Her pain is 4 out of 10. Aching. She's cooperative, ambulates independently, and she's a low fall risk. Her chest expansion is symmetric. All lobes clear to osculation. Productive cough with scant secretions and clear. She's on room air. She's tachycardic, regular rhythm, S1 and S2 present, no murmurs or extra heart sounds, slight +1 pitting edema in lower extremities. Femoral pulses are 2+ bilaterally and 1+ pedal pulse in both feet. She's on telemetry. She's got bowel sounds active in all 4 quadrants. Her last bowel movement was on Sunday. She's got diminished appetite. She's on a 1,500 milliliter fluid restriction, renal diet. Her abdomen is soft, round, non-tender. Patient said she's recently gained 10 pounds. She said she's had difficulty voiding. Her urine is amber and cloudy, and her last INOs were 375 and 200 milliliters. Her skin is warm and intact. Mild diaphoresis, no lesions. She's got a functioning AV graft, which is clean, pink, and intact. Root and thrill are present. Her cap refill is less than 4 seconds, and she's got an IV, 18 gauge peripheral IV in the right forearm. Her last vital signs, she had a fever of 101.1, 95 heart rate, 96 oxygen, blood pressure 138/78. Her respirations were 20. Her blood glucose was last checked at 155. She's on clonidine, aspirin, calcium carbonate, insulin, atorvastatin, sodium chloride 30 milliliters an hour, imipetin/cilastatin 500 milligrams every 8 hours, and that's the medication that's coming up soon, and all of her labs are pending.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication administration and watch you demonstrate giving the med in the patient's room?
No problem. What do you want to know?
Why specifically is the client receiving this medication, and what action does the medication have on the body?
The client has an infection, a possible UTI, and the medication is a broad spectrum anti-infective antibiotic, and it attacks the cell wall and causing the cell to die, so it's bacteriostatic.
When should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs must be monitored? And which physiological parameters should be monitored when the med is being administered?
You want to question administering this medication if the client has cross sensitivity to penicillin or cephalosporin. You also want to make sure that they're not on aminoglycosides, because it would, if the medication wouldn't work as well. You want to see if they have any hypersensitivity and any renal issues. And even though this patient does have renal issues, she's got end-stage renal failure, so it necessarily doesn't really affect how the medication is going to be excreted, because that's why the cilastatin is in there, so it stays longer in the body. You want to monitor your vital signs, your temperature, your respiration rate, your blood pressure, your weight, your INOs, physiological parameters. You want to watch for signs and symptoms of an infection, signs and symptoms of a super infection, of an allergic reaction, which she would have like edema, swelling, difficulty breathing, and yeah.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
Okay, you want to make sure that it's the right, here you want to make sure it's the right patient, the right dose, the right route, the right medication. You want to make sure it's not expired, that it's stored in the proper place, that it's good to take, and you want to double check and make sure that the MAR and the physician's order and the patient's chart are all the same to make sure that it's safely administered in the hospital setting. You want to correctly ID the patient as well, and yeah.
What are the side effects and potential adverse reactions?
Side effects of this medication, you could have anaphylaxis, like the shock. You can also have seizures with this medication, and nausea, diarrhea, and vomiting, and like a type of like colitis.
How will you know the medication is effective?
It will decrease the signs and symptoms of an infection. Any more questions?
No, thank you so much for answering my questions.
Not a problem. It's important to know your patient and the medication to keep your patient safe. Okay, so now we're going to go and administer the medication to the patient. So I'm checking the MAR with the physician's orders and everything, and I've got here, which is sodium chloride, which is 30 milliliters an hour. I check that, and it all checks out. And then I've got the imipenem, and that's 500 milligrams, and it's already pre-mixed, and we're giving that every 8 hours, and it's at 200 milliliters an hour. So I check this, that checks, and that checks with everything. And I've got my tubing we're gonna give this one piggyback, and this is our primary, and then we're also gonna check the IV site for patency, and make sure that there's nothing. We have our little label